So the second segment of the final advanced health assessment skills lab, when I do get checked off for advanced health assessment for nurse practitioner school. The second region is going to focus on the throat as well as the chest. As you can see, I kind of marked this. I'll talk about what that is. And then lastly, let me cut away these muscles right here. Boom, boom, boom. So we are going to run our stethoscope to listen. Man, I don't know if I can see the lungs, but yeah. Anyways, you're going to be listening through these lungs, and then you'll kind of make sure you listen to the right lower when you start listening to the lungs. But yeah. Okay. So first thing you want to do, you want to work from the neck. We're going to be putting our 3 fingers right there on the patient. And then we're going to make sure this trachea is don't delete it. All right. We're going to be making sure his or her trachea is midline. That means that if it's going one side more than the other, it means like one of your lungs is deflated. You're going to have problems if that's the case. But if your lungs are both working normally, your trachea would be midline. We're going to check the thyroid. Make sure there's no nodules or nothing like that. So this little V right here, this little V, that's your suprasternal notch. Supra meaning superior or above the sternum. That's going to be 1, and then you're going to be kind of like using this. This is your thyroid cartilage. This is your cricoid cartilage, otherwise known as your cricoid process. So between these two, you're going to put your finger there. You're going to have the patient swallow, and that's going to be testing if you got any kind of thyroid nodules. Next, we're going to be checking cranial nerve 11. This is cranial nerve 11. So somewhere here, yep, this is cranial nerve 11. This is responsible for these trapezius muscles right here, right? These kind of lift your shoulders. They help you shrug. So these things are innervated by cranial nerve 11. Let me try to find it. It's a pretty complex system, but let me try to find. Cranial nerve 11 is right there. That's cranial nerve 11. So that kind of lifts your shoulders up. That contracts these muscles and lifts these shoulders up. So when they can lift their shoulders against resistance, that's making sure that cranial nerve 11 is intact. So you put resistance on them and you have them shrug, you're testing out cranial nerve 11. So that's the neck part of it. Next, we're going to check the ribs. So we're going to want to get the bell of our stethoscope. So the best way to go is all physicians enjoy taking money. That's aortic, pulmonic, Erb's point, tricuspid, and mitral. These are all representing valves. So the aortic valve, it's right side of the sternum, second intercostal space, left side of the patient's sternum, second intercostal space, third intercostal space, left of the sternum, that's Erb's point, tricuspid, fourth intercostal space, left of the sternum, and lastly, fifth intercostal space, left of the sternum on the mid-clavicular line. Notice this little line kind of goes down. That's the mid-clavicular line right there. And that's the mitral valve sounds. So when you hear the whooshing sounds, that's usually some kind of regurgitating in that valve, a sign of heart murmur. If you hear any extra heart sounds, that's usually a sign that somebody's starting to develop heart failure. So those are something to keep in mind. NNP, you definitely are expected to know it. In BSN, you might get shit for it if you don't know it in skills lab, but they're not going to fail you for it. But you Ideally, you should be able to detect heart failure just by hearing some extra noises when you're running your stethoscope. Next, as an NP, you're going to be checking between the intercostal spaces, listening for the ribs, and then you go back here, and then right under the scapula, 1, 2, 3, 4, 5, and then lastly, make it a point of listening to 6. But the most important thing is you kind of listen down here, and you make sure you can kind of hear their lung down there. Then that would be the that would conclude this aspect of the this portion of the advanced health assessment. And then after that, we're going to be doing basically kind of like the abdominal and then like range of motion type shit. So we'll get into that in a bit.